Hi, welcome back to Christine's Health Affairs. I have some news for you. Some of it's good and some of it's probably not so good. Well, for me anyway. But I'm going to share that with you in just a moment. Do you like my earrings? I've received so many pairs of earrings from viewers and I'm going to have to get them out and at least wear them all. I'm going to have to get them out and wear them at least once. So these are made with guitar picks and they have a little medallion, a love medallion on them as well. So very cute, very bright and colourful. I'm not used to wearing dangly earrings. I usually just wear my sleepers in my ears. But yeah, very cute. Anyway, what's been happening? Today is Tuesday. I'm going to chemo tomorrow morning and it's supposed to be my big week where I have immunotherapy, the carboplatin and the paclitaxel. If you remember last week, they ended up cancelling the paclitaxel because of the numbness that I've been getting, the neuropathy. So with that, the oncologist phoned me yesterday and she said that she wasn't comfortable going forward with the paclitaxel and that I wouldn't be doing round 11 and round 12 coming up in the next couple of weeks of the paclitaxel because of the neuropathy. Tomorrow is supposed to be round 9 of chemo and that's where I have the paclitaxel and the other two drugs. For whatever reason, she didn't really want to go forward with just the carboplatin and the immunotherapy. So what she's decided, or what she's suggested, is that we scrap the next 3 weeks and finish up this first regime of chemo. So the first regime of chemo was supposed to be 12 weeks, every week, with cycling chemos each week, every 3 weeks, and then it's repeated. So now we're going to go forward with the second regime of chemo, and that's the one that I haven't really been keen on or looking forward to. Not that you ever look forward to any, but this one's going to be harder on the heart than what the current regime has been. So 4 weeks of chemo has been scrapped from my whole chemotherapy program, which is fantastic news. Instead of 16 rounds of chemo, I now have to do just 12. And I no longer have to go every week either. So from tomorrow, chemo is every 3 weeks, but what I'll be having is the Pembro, which is the immunotherapy, steroids, of course, because that goes with every chemo round. There's another chemo drug, and then there's another one that is called doxorubicon, which is known as the red devil because apparently it's a red liquid that gets injected into your body. It comes in a bag with red liquid, and yeah, it's just been given the name red devil. Now, I had a heart scan done a couple of weeks ago and the results for that have come back. So this red devil, or the doxorubicon, is the one that potentially can damage your heart. And it's something that can damage your heart early, or it may not happen for 20 years. It may not happen at all. It just depends on your own health, I guess, and yeah, the condition of your heart. So I don't know if anybody knows or remembers that a few years ago I had what's called a non-STEMI heart attack. And the reason I had that was because I'd been really ill. I'd got some sort of an infection and I'm allergic to penicillin, and I was taken to hospital via ambulance. Everybody knew that I was allergic to penicillin. Even the hospital, when I arrived in the emergency ward, knew that I was allergic to penicillin. And the doctor, in his wisdom, decided to give me penicillin anyway. So as a result of that, I went into anaphylactic shock, and they had given me, over the course of several hours whilst they were trying to keep me alive, they'd given me 4 litres of fluid, they'd given me 2 shots of adrenaline, which was horrific. I was aware of all of this happening, and it also caused me to have a heart attack. So the 4 litres of fluid, when they injected the adrenaline, caused my body to have convulsions, because that's what it does, gets your heart going. And the fluid ended up in my lungs, caused me to get pneumonia. So I ended up in intensive care for 5 days and thereabouts, and ended up in hospital, I think, for about 8 days all up. And it was during COVID, so I went there with no clothes, just my mobile phone, and that's all I had for company for that entire week. And yeah, we weren't allowed to have visitors, and it was 2 hours from home, so Chris had to go back home, look after everything here, and I was stuck in hospital in another town. Anyway, I don't know if the results of my heart scan are related to this heart problem that I had a few years ago. That's all been dealt with, and I've had heart scans since then, and the heart people have said that, you know, my heart muscles repaired itself, everything looked really good. I have high cholesterol, I have, you know, normal things like that. But the oncologist, when she phoned us today, she did say that my heart function is good. It's the blood's pumping through really well and everything that she would like to see, but my heart muscle is stiff. So stiff heart syndrome, I think, is a thing. But anyway, my heart muscle is stiff, and this could potentially cause problems with the doxorubicon that I'm going to start having. So if you imagine when you're blowing up a balloon, this is how she explained it to us today, I think it's the blood going into the heart it's stiffer going in than it is coming out. So when you're blowing up a balloon, you might find that it's really, really difficult to blow up a balloon because you can't get air into that really narrow passage, and because it's really stiff, that rubber is stiff. So it's a similar scenario with my heart. Now, it's because of that, there's an increased risk of me having heart failure going forward with the doxorubicon. And I kind of had to make the decision today which way I was going to go forward. Do I continue with chemo? Do I stop the chemo? Do I risk cancer coming back? Or that's if it's even gone. Do I risk having problems with my heart? And it might not happen for 20 years. I mean, I'm 61 years old now. I may not have problems at all. It just may progressively deteriorate over my life, because these things do happen. So we did ask the question about whether we just cancel chemo altogether and not go forward. We can't go ahead with the paclitaxel because of the neuropathy, so that's completely out of the off the table now. And we can't use a mixture of other drugs. It needs to be the doxorubicon in the next few rounds. I'm only going to be having 4 rounds of it, but they do have the potential to cause problems either now or in years to come. I asked the question if we could have surgery instead, and then see if there were any cancer cells there at all, and if there weren't any cancer cells, then I might be able to go ahead with radiation therapy. But that presents other problems if I have the surgery and then we've got to have chemo after, and you know, things like that. There's all that medical stuff that I don't understand. The other thing too is the increased risk. I mean, I might be 10% higher risk of having heart problems because of the stiff heart muscle. But the risk of me having cancer regrow or come back or get worse is far greater than the risk of me having problems with my heart. So I kind of have to or had to make the decision based on what's going to be the best outcome for me going forward. As far as the heart muscle is concerned, if I do have problems, there are treatments available. I found out today that heart transplants completely off the table. Apparently they're really hard to get anyway, but if you're a cancer patient, it's completely off the table. So there is no chance of a heart transplant for a cancer patient. I didn't know that until today. But there are other treatments available. You know, you might need a pacemaker, or it may even just be blood thinners to begin with. So there are different treatments available. But if I don't do the chemo, my heart muscle is still going to deteriorate eventually anyway, because it's already stiff. So I don't know if in 1 year or 10 years or 20 years I'm going to have these problems anyway. But if I don't do the chemo, the risk of the cancer growing, and because remember it's a very aggressive form of breast cancer, so it doesn't need anything to feed itself. If I cancel chemo, then I run the risk of the cancer recurring if it hasn't already gone, and that will grow a lot bigger. The oncologist, I asked the question a few weeks ago, how long would I have had to live had I not started chemo? And she said between 12 months to 2 years. So yeah, I think I'd rather take the chance and go ahead with the chemo. That's the decision that I've made, is that I'm going to go ahead with the chemo going forward. I'd rather wipe that out, the cancer out completely, than have that come back and then have to go through the whole rigmarole again. I don't know how much of that I could cope with. So yeah, that's what we're doing. We're going tomorrow to chemo. I've got the Pembro, which is the immunotherapy, some other chemo drug, I can't remember what it's called, can't even pronounce it, and the doxorubicon, which is known as the Red Devil. So look, we're going to try and stay positive and hope that it doesn't have an effect on the heart. I am having a scan in a couple of weeks' time to see how far the tumour has shrunk. Hopefully it's gone. And then it may be possible that I don't have to have all 4 rounds of this regime going forward. But we'll see when I get the results from the ultrasound. So that's it, my update. Good news that I don't have to do 4 rounds of chemo. Not so good news that I don't have as strong a heart as I thought I had. But I'm just going to have to deal with that as things happen. So have a look at this old girl. She has just been in the corner on the couch the entire evening, not talking to me at all, not interested in anything. She's had her 2 walks for the day. Oh, by the way, I have been feeling fantastic. Not having had chemo for 2 weeks, I just feel amazing. I've done so much. I worked for the entire weekend. I think I mentioned last week we are open 3 days a week, over Friday, Saturday, Sunday. I didn't go home for a nap once. And even on a normal day before chemo, I would have liked to have gone home for my afternoon naps. But I was determined. I was not going to go home for a nap. I had so much energy. It was really good just to get up, go for a walk in the morning with the dog, and then go to work, spend the day there, and then go for another walk in the evening as well. So our walks have actually extended in distance as well. And I think I might take you for a walk when we're having work done on the boardwalk at the lake at the moment. So once that's all finished, I think I might take you guys for a walk with Coco and I, and we can have a bit of a look around the town. So anyway, that's my update. Off to chemo tomorrow. Hopefully this one doesn't knock me about too much, but at least going forward, Chris and I only have to go down to Melbourne once every 3 weeks now instead of every week. So that'll give us a lot more time at home. Anyway, cancer's tough, but we're tougher. I'll catch you next time. See ya.